Hi everybody, welcome to Ask Dr. Manny. We have our blog today. Today I'm talking about the month of February is heart disease awareness, and the American Heart Association just came out with some numbers which are a little bit encouraging because we have been able to reduce heart disease and all the complications by 25%. However, heart disease is still the #1 killer in the world. So you can take all the diseases combined, especially all the cancers, and still heart disease, heart attacks, strokes kill more folks here in the U.S. than any other type of disease. But it's very encouraging because one of the things about heart disease is that it can be prevented. You know, there's many things people can do to minimize their chances of developing heart disease. You all know them: smoking and minimizing developing diabetes by being overweight, watching your cholesterol, exercising. All those things are very important, and if you do them, you're going to reduce heart disease. Now, doctors typically, doctors in the U.S., like any place in the world, basically we react to a problem. In other words, we keep focusing on how to treat patients in the hospital, so we have better techniques of catheterization and we have all these fancy equipment. But the key to preventing heart disease is it's try to define patients at risk where they have factors that may lead to heart damage, and also how to recognize heart damage. So to that effect, there's a new tool that is being developed, and we will have it up online pretty soon as we get our hands on it, which is a risk assessment tool. You know, we keep saying that, look, the new 50 is, or the 50s is the new 40s, and the 40s are the new 30s. And, you know, a lot of folks walk around at the age of 45 feeling great about themselves, but they have a heart that is 55 years old. In other words, 10 years older. And that is what this new risk assessment tool is all about, trying to identify risk factors and, kind of create a chronological age for your heart, so that, let's say you are 45 but your heart is 55, that puts you on that 10% increase, and therefore maybe with just dieting and exercising and getting rid of those cigarettes that you so much love, you will be able to reverse that aging process of your heart. If you fall into the 10 or 20% increase, in other words, if you're 45 but your heart looks like it's 60, then you might be looking at some medication, and it gives the physician and the patient an input into whether or not you need to go on medication early enough so that you can prevent diseases. So this tool is going to, I think, somewhat revolutionize the way patients are being looked at, and hopefully it will, create a buy-in by the patient in order to prevent heart disease, which is at the end of the day what we're trying to get. It takes two to tango, guys. It takes the doctors to come up with the tools, but it takes you guys also to pay attention and get rid of all those risk factors, and you'll see that we'll go from a 25% reduction in heart disease in this country to perhaps 50%, which is the goal that we have coming up. So there you have it. We will have that questionnaire coming up soon. Get all your information at AskDrManny.com and send me any questions you have to AskDrManny.com regarding this or any other health topic. Until next time, I'm Dr. Manny.